In my clinical role, I am a hospitalist at the psychiatric facility, and I'm on the infectious disease committee. And in my military role, I typically work as a task force commander, and the principal function of any military physician is sanitation and hygiene. We deal with a population in the military that is generally healthy, so the idea is to keep them healthy. And sanitation and hygiene is critical in that. And so I have about 30 years of experience dealing with that, as well as humanitarian relief. So that informs me. And isolation is a scary term for people. It doesn't have to mean that you don't see anybody else. It has to mean that you have to learn what the barriers and distances are, as well as quarantine periods. So if I know that you were in China, say, since we're talking about coronavirus these days, if I know that you were in China 30 days ago and you've had no symptoms, because I know the incubation period of coronavirus, I'm not worried about you being infectious to me. If I go down to the urgent care because I have a relatively minor illness and the waiting room's full of people coughing, there's a good chance I'm probably going to walk out of there having been exposed to pathogen. And so I think that's part of it, is understanding what diseases you're concerned about, understanding prevention measures, which are still very simple and very basic. It's hard to teach people to do them, though. And being mindful of what you need to do as a leader to implement those things. Okay, again, I'm going to refer to coronavirus right now. If you go to the CDC website, let's say advice for employers, and the CDC's put that out. One of the things is employers, and this applies to anybody, and by the way, it's written in lay terms, it's not medicalese, is being understanding when a person calls in and says, I'm going to stay away from work because I'm coughing. So there's self-isolation. I have symptoms that may be concerning. I don't feel particularly ill right now necessarily, but I know that coughing is a problem. I'm not going to go to work. I'm going to let my boss know I'm going to stay away from work today to prevent spread. Likewise, people being sensitive in the work environment when someone appears to be sick, saying, why don't you take off today? You know, and just take it easy. Maybe we can give you some work from home, but get yourself away until we know if this is going to get worse, okay? More severe cases of isolation would occur, say, like in East Africa when there's an Ebola or West Africa when there's an Ebola outbreak, where entire villages just block themselves off. So an uninfected village will put roadblocks up to prevent anybody from coming in to prevent spread, especially if there's a village nearby that has an Ebola outbreak. That's isolation. So it can either be isolating myself in the workspace so I'm not near you, I'm outside of coughing distance maybe, getting more space, like people spread out a bit, okay, and don't go to lunch together or get in close confines while people are sick. Or it could be as extreme as an entire community isolating itself off and not letting people in until the concern's passed. And by the way, hand washing is a form of isolation. People tend to forget that disease is, you know, you could see the threat. You could see the car about to run through the red light, and even then people get hit. But you don't realize that when someone sneezes and hits a doorknob and you touch that, you've just put millions of bacteria in your hand. Now, you don't see them, so they don't appear to be a threat. But the minute you wipe your nose or rub your eyes, now you've got a problem. I wash my hands 30 to 50 times a day. And that's a reason why a lot of people who are sensitive in healthcare, especially people who are sensitive to infectious disease, don't get sick. We work around sick people all the time. How is it we don't walk around sick all the time? Hand washing, isolating ourselves from respiratory illness. That's happening right now in the CDC. It's happening with the Ohio Department of Health. It's happening in our local public health departments. They are watching and monitoring updates. Just for instance, because I knew this interview was coming and I wanted to seem reasonably informed, I went to the CDC website and I looked at the states that are currently affecting the United States. Okay, up-to-date information from reporting to the CDC that says this is the states where we found people with coronavirus. Okay, in Ohio yet, nothing. Okay, doesn't mean there's someone. Does it mean that there's nobody with coronavirus in Ohio? No, there could be people who are affected by coronavirus, but novel coronavirus now called COVID-19, which is just named yesterday, could be a spectrum. It could be relatively minor illness. Someone would say, I have the flu. I have a minor case of flu. I'll just stay home. And they don't report it. It could be more serious. People who have actually died, you've heard about them in China, that end up on ventilators and more serious illness. So the CDC tracks that stuff. The public health departments track that stuff. Ohio has updates all the time from the Department of Health. that are looking at what are we doing in Ohio. The reality is, though, with viral-borne diseases, they're scary things, and the reason why they're scary is because people will act as people will act. We've already talked about isolation. This is the best single thing you can do for a massive viral outbreak, is isolate yourself until it runs its course. It's how we handled Ebola. It's how ultimately the 1918 flu pandemic should have been handled, but it wasn't. There is no medication for coronavirus. There's no immunization for coronavirus. The only thing you can do is hygiene, isolation, sensible avoidance of the workplace until it runs its course. We have a little different situation, by the way, here than they do in China. China has massive, large population centers, and predictably, that's where I would expect to be looking for those things to occur in the United States. So cities like Chicago, Los Angeles. But I would remind people that each of those cities has public health departments with sanitarians and epidemiologists who are also watching these trends and trying to educate healthcare providers, trying to get them to the knowledge of how do we handle people coming in with respiratory illness. What should we be doing? Reminding them to use their personal protective equipment. Take the time to do that.